initial primary complaint of right knee pain, but it subsequently had progressed to her whole leg, from her buttock right down to her foot. This started, let's see, June. The onset of it was June of 2021, when she was just picking beans in her garden, and she experienced right knee pain only. And she thought she had twisted on it wrong or something like that. I remember her remarking, but she couldn't remember. It wasn't like some sort of specific incident. She was just picking beans in the garden, and then she felt this onset of right knee pain. She thought, like everybody else, she thought it would go away, and give it some time, some ibuprofen, yada yada. Wasn't going away. Went to her primary care physician, who said, you probably need to see ortho. So they fast tracked her into ortho, and she had an x-ray and an MRI within 10 days of each other. And this was in late July and August of 2021. She had a session of PT, so I don't know how many visits it was, but it actually, she said, made her worse. She went back to ortho. I'm just going to give you the history. And then ortho said, well, if that's not working, then we'll probably just have to do, well, his direct quote was, we'll just have to get in there and look around. I'm like, wait a second. So failed PT, and that means that you have to have surgery right away. So eventually then the surgery didn't work. But let's go back to the initial session. So if we just look at what was in front of me at that moment, she had right leg pain and tingle from the butt down to the foot. It was intermittent.
Ryan, are we talking posterior leg or the whole leg?
Posterior leg.
Okay. But at onset, it was only the knee. And then at some point later, the leg started to include thigh, calf.
Yes. And yeah, right into the foot, which,
Sure.
and I tried to, it's a good question, like when did it start progressing? And I even asked her. And she said that it had progressed into sciatica before the surgery. So she ended up having a knee surgery, and that was November of 2021.
Okay. So sometime between June and September, it started to include the leg, but it truly was knee when she was picking beans.
Yeah,
She just attributes it to that, although she doesn't have a particular incident or movement in the garden.
correct.
Yeah.
Correct.
Yeah. All right. Can we talk about this for just a minute before you
Yeah.
more? Just at the end, this is not fair to you because you can't necessarily remember exactly what you were thinking. But if you try to, you've got a 69-year-old female, fairly active. She's gardening, right? Right knee pain. Was it constant or intermittent at onset or when you saw her?
When I saw her, it was intermittent. When it
Yeah.
started, I'm not really sure because there was a year and a half difference. And I
Yeah.
don't even think maybe she didn't even realize it.
No, sure. Yeah, so that's not a fair question. All right, but when you saw her, intermittent right knee pain, including now the posterior thigh and posterior calf to the foot,
Yeah.
PCP, ortho, onto PT, made it worse, back to ortho, and then she'd already had the surgery before you saw her in November.
Yeah, which had
Yeah.
failed.
Yep. So just right there, before you even get into the better worse section,
Yeah.
what are you thinking? What's on the table? What's your next question and why?
Yeah. So she has intermittent knee pain. So I remember the first thing that I thought was there was no true mechanism of injury, and you have local knee pain. I said, and because I remember trying to tease this out a little bit, I said, do you remember like doing something strange with your knee? Did you pivot? Did you twist? Did you do anything? She's like, I don't know, maybe, but because
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.